Welcome to our webinar this afternoon, and obviously you are here for a webinar that will be addressing forensic evaluations and really focusing on how we use some of the data from the WAIS-IV and the WMS-IV and advanced clinical solutions for WAIS-IV and WMS-IV in several types of forensic evaluations. Today we're really going to be focusing on child custody evaluations and an evaluation of an individual who is facing capital punishment. So a couple things that I wanted to mention just to set the stage in terms of looking at this topic and thinking about forensic evaluation in general. Certainly many of you are quite familiar with the Supreme Court decisions that are relevant to these topics, and I'm sure many of you are familiar with many of the relevant state regulations pertaining to these types of evaluations. However, if you are relatively new to the forensic practice, some of these resources that you see here on this page might be helpful to you in follow-up to today's session. But again, I think it's one of the real challenges that we have in conducting forensic evaluations is that we see that mental health professionals and attorneys and the courts and states in general have a variety of different approaches in how competence is assessed and the way in which these kinds of evaluations are conducted. So part of what I want to do today is really present some of the validated, standardized kinds of measurements that really can help in these kinds of evaluations, since you will be presenting most of the time to in a court setting. It's important to have confidence in the kinds of instruments that you're using. So again, part of what we'll be doing today is really trying to wrestle with some of those challenges in terms of the variability that does exist in the field in terms of how forensic evaluations are actually conducted. I do want to make sure that everybody is aware that, of course, I am the Director of Training for Pearson Clinical Assessment, as Sherry had mentioned, and therefore I will be using Pearson products in our case examples during the webinar today. So our general objectives for today's session include providing you with a brief description of some of the contemporary standardized measures for forensic applications and really looking at some of the best practices in the assessment of pertaining to child custody and, as I mentioned, looking at capital punishment types of evaluations. My goal is to provide you with some sample case information that describes and really demonstrates the use of some of these instruments in order to address the specific clinical questions that we're tackling today. So in order to start off, I wanted to make sure that everybody was familiar with the basic content and structure of several of the instruments that we will be talking about today. And of course, the WAIS and the WMS and the ACS were developed to be used together. And again, when the test developers were putting these instruments together, they really wanted to create basically a system so that clinicians could use various instruments and various portions of instruments to provide unique information about examinees and address very specific referral questions. So again, as we go through some of this information today, I'll just be giving you a very brief sample of some of the types of data that may be collected from these instruments. It's certainly not meant to be an exhaustive training on how to use any one of these instruments in general. But there are some things really to consider. And of course, as I mentioned, these are really three separate instruments that were designed to work together. We didn't we didn't choose to put all of the different components into one instrument, because then you have this massive assessment where not all clinicians would need to use the subtests that were included. So again, the expectation is that based upon the kinds of cases that you're presented with and the kinds of questions that you're needing to answer in the forensic evaluation, you as the clinician would select only those measures that are appropriate to fit the practice and certainly your competence, as well as addressing the needs of the client. So, again, one of the strengths that exists here with the WAIS, the WIMS, and the advanced clinical solutions for WAIS and WIMS is that they were built together to really help us in identifying some of the underlying cognitive difficulties that are relevant to forensic assessments. And, of course, one of the strengths of these instruments is the fact that they were co-normed. And because of that co-norming, again, we have a much stronger basis in terms of providing the psychometric data and having that data stand up in a court setting. So, again, these are just important things to consider as we begin to look at the application of these instruments in a forensic type of a setting. So the first thing I wanted to do was just to provide a very brief overview of the content and the structure of the WAIS-IV. And again, this isn't meant to be an overall WAIS-IV or WIMS-IV or ACS session. So if you're not familiar with the content and structure and administration procedures, I do suggest that you take advantage of one of our other webinars that would address that. But as you can see here, of course, the WAIS-IV is developed for individuals between the ages of 16 and 90, and there are a number of key scales that are certainly relevant to understanding the overall functioning of an individual, and several new subtests that are part of each one of these indices. Now, what's not listed on this particular slide is, of course, the General Ability Index. And the General Ability Index is something that is available with the WAIS-IV, and it is going to provide you as a practitioner with a summary score that does minimize the influence of working memory and processing speed. And so as you look at calculating and using the General Ability Index, of course, this is going to be the sum of the scaled scores for the verbal comprehension subtest and the perceptual reasoning subtest. Now, this is important because when we think about using the GAI in forensic evaluations, it's important to recognize that it is used for discrepancy comparisons. So, for example, when I'm needing to compare ability and memory or ability and achievement, for example, the GAI is an appropriate measure. The GAI, though, is not a replacement for the full-scale IQ. And it's important for us to recognize that the GAI is used primarily when we see neuropsychologically based deficits adversely impacting overall performance. So most typically when we're working with clients, we're going to see that, for example, with traumatic brain injury, we may see some of these deficits in working memory and processing speed. And again, if we are seeing those kinds of impairments in working memory and or processing speed, then, of course, that full-scale IQ will be depressed because of the contributions of these areas or of these neuropsychologically based performances. So again, we're not replacing the full-scale IQ with the GAI, but rather we are interpreting that GAI and using it for appropriate discrepancy analyses in our overall analysis of the cases that are presented to us. So again, in thinking about when to use the General Ability Index in a forensic evaluation, it should be addressed if a significant and unusual discrepancy exists between verbal comprehension and working memory, or perceptual reasoning and processing speed, or in looking at, of course, discrepancies between working memory and processing speed, and again, in looking at the scatter that might exist between the subtests within those measures. Again, the full-scale IQ is going to be our most valid measure of overall cognitive skills, or G, and, of course, the working memory and processing speed components are vital in our comprehensive evaluation of cognitive skills. And I think that that will become even more apparent as we get into some of the case studies. Again, we would be using that general ability index when we're doing comparisons with the Wechsler memory scale, 4th edition. And again, if you have not had experience with the WAIS-IV yet, just keep in mind that it is a comprehensive measure of memory and learning that addresses things like basic encoding, looking at how information is consolidated, and certainly the role of working memory in the consolidation process, as well as looking at the retrieval processes that are involved in memory of specific information. So the WAIS-IV is, of course, comprised of several subtests. You can see those subtests here. Some of them have been retained from the WAIS-III, and some of them are brand new kinds of subtests. Again, if you have not seen the WAIS-IV yet, I strongly suggest that you look at the pre-recorded sessions that we have available that give you an overall review of these subtests and the instrument as a whole. But in terms of just looking at the basic structure, you can see here that it does contain measures of auditory memory. We're looking at both immediate and delayed memory capabilities. We have the ability to look at working memory, visual working memory, that is, as well as just a visual memory index in general. Now, you can see here that it really is divided into two batteries. One battery that would be used for individuals between the ages of 16 and 69, and an older adult battery that would be used for individuals who are between the ages of 65 and 90. And as you can see from this visual, the older adult battery that is of the WAIS-IV is somewhat shorter, and again, this takes into account some of the issues with fatigue that certainly can impact performance in our older adult population. So again, this is just a quick overview, and the kinds of scores that are provided by the WAIS-IV that you'll see in the case study some of them will be very familiar to you, I'm sure, in terms of looking at just basic subtest scale scores, and those, of course, have the mean of 10, standard deviation of 3. I imagine you'll be familiar with index scores, process scores, maybe a little bit less familiar to some of you, but these really help us in delving in and looking further at an individual's memory capabilities, as do the contrast scores. And as I mentioned, we do have several introductory webinars that will provide you with great insights into how to use those contrast scale scores. But they are extremely useful in cases related to forensics because they do allow us to specifically delve into whether, for example, an individual's delayed memory skills are stronger or weaker as compared to their encoding skills and individuals who have similar levels of encoding. So, very useful in terms of really understanding a person's overall performance. Now, as I mentioned, I know I'm going through a lot of this information relatively rapidly because some of you are familiar with Advanced Clinical Solutions and WAIS-IV and WMS-IV, but I felt that I needed to do some of this prior to actually getting into the case studies. So, I'm curious, how many of you have actually used the Advanced Clinical Solutions or the WMS-IV? So I'm just looking at some of the numbers coming in. Again, for those of you that have not had a chance to really use these instruments, you might want to think about attending one of the introductory webinars that we have available, or the pre-recorded sessions that are available, to give you a much more detailed view of what this instrument is all about. But just in terms of providing you with a little bit more information regarding the ACS, it is a combination of several approaches. So in the ACS, we can look at whether or not an individual we can get a sense of their premorbid functioning. So, for example, if we were dealing with somebody who had a brain injury, we could look at whether or not their skills seem to be different from, at this point, if they were different as compared to the time before the injury. So, again, that premorbid functioning can be extremely useful in understanding and applying the kinds of results that we need to analyze for forensic assessments. As you can see, there are also a number of effort scales that are part of the Advanced Clinical Solutions, and we'll be talking quite a bit about that during our case studies that I'm presenting. And, of course, effort as it relates to forensic assessment is extremely important, as we need to ascertain, is this person's response style, and are the results a valid estimate of where this person is functioning, or is there some indication that the individual may be trying to exaggerate symptoms in order perhaps to get out of a punishment. So again, effort becomes a very important component as we look at forensic applications. One of the nice advantages of the ACS is that many of the effort indices that are used are simply embedded within the WAIS-IV or the WMS-IV. And simply by doing components of the WMS-IV, we can actually simultaneously obtain information concerning effort. So in terms of minimizing the amount of time that you need to spend in assessment, that can be a distinct advantage. Another key area, of course, that the ACS looks at would be social cognition, and the role that social cognition plays in an individual's understanding of the world around him or her in terms of processing affect and things of that nature. And then also, of course, the key role of executive functions. And there are a number of components of the Advanced Clinical Solutions that come from the Dellis-Kaplan Executive Function System that allow us to look at cognitive flexibility, the ability to inhibit responses, and things of that nature. So I'm sure those of you who have conducted forensic evaluations are aware of the importance of executive functioning in terms of understanding that person's overall response style and their ability to regulate behaviors and emotions in understanding what they are doing, or maybe how they responded and why they may have participated in a particular event. And then, of course, we also have available the Texas Functional Living Scale, and this is linked to the WAIS-IV and the WMS-IV, and this instrument is really used to look at daily living skills. And of course, daily living skills are important in that we need to look at this as a component in evaluating intellectual disabilities. And again, that will be an important component in one of our case studies as we move forward. There is also software that is available with the advanced clinical solutions that allows us to look at demographically adjusted norms as well as some reliable change scores. So we're not going to spend a whole lot of time on reliable change scores as part of this webinar, but if you were following, for example, an individual who had experienced a traumatic brain injury and we're doing serial assessment, those reliable change scores can be very, very helpful. So let's take a shift now and really look at some of the best practices and how we might be conducting forensic evaluations. And of course, neutrality on the part of examiners is a key component. These are difficult cases, as you know, and it is important for us to be very cognizant of all of the professional boundaries and the ethics that are important to these kinds of assessments. It's important for us as clinicians as well to recognize our own values and beliefs. We may have some inherent biases that would suggest that we should not take on a case if we have a particular bias, for example. So certainly these are highly contentious cases. There may be multiple relationships that need to be taken into consideration. So, for example, particularly in a child custody evaluation, you do need to be mindful of those multiple relationships if you had been seeing a couple or a family, for example, as part of a therapeutic relationship or a counseling relationship. And so you would really want to think about those multiple relationships and make sure that you are abiding by all ethical procedures. Now, in preparing for your evaluation, of course, there are many things that we need to take into account. Many times these kinds of evaluations will be court-ordered, or there will be stipulations that are provided from the legal counsel. But very often it's the first job of the psychologist to figure this piece out and really determine what the purpose and the scope of the evaluation is. We really need to look at informed consent in forensic kinds of evaluations. That client needs to be informed of how the data will be used. And of course, if capacity is an issue, then we really need to be looking at the authorized consent from another appropriate authorized person. So let's turn our attention, with that background information. Let's first address a clinical application with a custody evaluation. And in terms of looking at some guiding principles for custody evaluations, of course, what we need to think about here is that the purpose of these kinds of evaluations really surrounds the best interests of the child. And so as a clinician, the child's welfare really needs to be my top concern, and I need to focus my evaluation on the parenting capabilities, looking at what the child's needs are, and the fit between the parenting capabilities as well as the child needs. And again, for those of you who are perhaps new to conducting child custody evaluations, a very helpful resource would be the APA guidelines for conducting child custody evaluations, and you can see that referenced here on this slide. Now, in conducting these evaluations as well, I always need to interpret within the context that is relevant to the key issues. So access to the child, the parents' ability to conduct appropriate decision-making, as well as, of course, the capability for caretaking responsibilities. And I need to always be interpreting my results, of course, within the context. And so I'm always going to be looking at aligning my findings with the environmental conditions that the parent and the child operate within. And so thinking about family support and or the treatment that a parent might be getting is an important part of my overall interpretation of this information. Now, as I'm thinking about putting together an evaluation, as I said, of course, it's always important for us to look at the purpose and the scope, of the evaluation and the specific kinds of questions that I need to be addressing. So one of the things that is important as well is to really think about what needs to be done, what kind of combination of psychological evaluation, interviews, behavioral observations, whether it's looking at the interactions between parents and children as part of that assessment. I may need to obtain some information from a variety of sources, such as the school or a physician or other child care providers or extended family members, for example. What I'm really doing is trying to develop a cohesive picture and corroborate the evidence that is being presented. In a child custody evaluation, it may or may not, my final analysis may or may not culminate in a final recommendation to the court. But let's take a look at a case example. And again, in this case example, we're probably not going to have each and every piece of information that we would want to have, but in the time that we have available to review these case studies, I had to make some choices. So obviously there may be some other things that you would want to know, but I think this will give you a good sense of how some of these instruments may be used in a child custody evaluation. So in terms of background for this case, as you can see, the basic scope of the evaluation is looking at access and caretaking. And, basically what we have here is client Y, who is the husband, has, as part of the divorce proceedings, asserted that his soon-to-be ex-wife is not fit to assume primary caretaking of their children, who are aged 2 and 4 years. And additional pieces of the background, these two have been married for 8 years. Been together for 8 years, married for 2. The first child was born before they were married, and child 2 was born after marriage. Additional background information includes the fact that the wife was involved in a mountain biking accident about a year ago, and she was biking with a few friends, and her helmet was not completely secure. Husband was not there at the time of the accident, but he indicated that a friend, who, by the way, is now part of the stress here, a friend had helped the wife get the emergency services that she needs. But again, there is a little bit of a conflict there because this individual is now reportedly romantically involved with soon-to-be ex-wife. But at any rate, the husband describes his wife as being very different since that accident. He describes her as more forgetful. She is on very much of a short fuse, very irritable in dealing with things, very disorganized, not really able to plan as well as she used to, and he also reports that sometimes she appears depressed. So as part of the evaluation, we put together multiple types of assessments, looking at, of course, any available records that we could access, perhaps relevant to the accident, looking at the emergency room reports, things of that nature. Also, of course, looking at a clinical interview, looking at the WAIS and the WMS, looking at some daily living skills or some functional living skills, and addressing some of the executive functioning skills as well. So, for example, looking at trail making and verbal fluency components that are part of the advanced clinical solutions, and again, our DKEFS subtests to address executive functioning. We also considered whether or not there were social perception issues in the client, as well as looking at suboptimal effort. Now, of course, what I'm presenting right now, I should clarify, is the evaluation of the wife, so client X. There would need to be an evaluation, obviously, that looked at the needs of the children, as well as the functioning of the husband as well, in order to do a comprehensive child custody evaluation. So you can see here from the WAIS-IV the results that were obtained, and probably not surprising to many of you. You can see that there are some deficits in the areas of working memory and processing speed, and again, this would not be a terribly uncommon finding in terms of looking at the results of a head injury, a reported head injury. We also see that on the perceptual reasoning subtest, there are there are very low scores earned as well. But verbal comprehension, again, very strong within the average range as compared to the other components. Again, for many of you who are familiar with head injury cases, this probably isn't terribly surprising, as we often see that the verbal comprehension skills are often remain uncompromised after many types of head injuries, though not all. If I look at the index level comparisons that are would be conducted, and again, you can do this as part of a by hand analysis using the WAIS-IV manual, or by using the scoring assistant that is part of the WAIS-IV. I can see that I have some very significant discrepancies that exist, particularly here as I look at the verbal comprehension index versus the perceptual reasoning index. Again, this difference of 30 points certainly exceeds the critical value that is listed here. Again, remember that critical value is indicating, of course, the value that needs to be reached or exceeded in order for me to make a decision that the difference is real. It's not due to error associated with the test or measurement error. So obviously I've reached statistical significance as I compare these two scores. The next point, though, is highly significant as well, and that is that base rate of 1.5%. What we see here is that a difference of 30 points between verbal comprehension and perceptual reasoning is highly unusual. It only occurred in 1.5% of the standardization sample. So what's important about this is that I not only have a statistically significant difference, but I also have a clinically significant difference. And again, that clinical significance is important because it tells me that it's not this difference is likely not just due to normal variation and individual differences that occur in most people's cognitive profiles. Rather, it is a highly unusual kind of a pattern. You can see as well that I have a number of scores here that have very significant base rates in terms of the differences. What this is indicating to me is that as I think about the interpretation of these measures, one of the things that's important for me to look at is probably her performance on each one of these index scores. That full-scale IQ, although it is a valid score, is not going to be a unitary construct. It is not going to represent a unitary estimate of her overall functioning. Now you can see here that I've also looked at the full-scale IQ versus the general ability index. Again, for discrepancy comparisons, I have the ability to use the general ability index, or I can sometimes use verbal comprehension index, for example, in those discrepancy analyses as well. You can see here that in this case, I have a statistically significant difference between full-scale IQ and GAI, and my base rate is at 12.4%. So in looking at these base rates, most clinicians will consider base rates anywhere from 10 to 15% to be clinically significant. So again, there's nothing that's written exactly in stone saying it has to be 10% or it has to be 15%, but common practice, and if you look at many of the recommendations from key scholars like Sattler, for example, you will see that 10 to 15% base rate is often considered to be clinically significant and, again, representing an unusual kind of a discrepancy. So as I look at her overall or general cognitive ability, I see that her overall cognitive skills are within the low average range, and again, her full scale IQ is 83, and her general ability index is an 89. Again, that full-scale IQ is going to be considerably lower because it does take into account, of course, the lower performances on working memory and processing speed. As I mentioned, in terms of interpretation, I do want to focus on those index scores because there was such variation in her index scores, and this would be a very useful interpretation or useful analysis in terms of looking at my overall questions regarding what kinds of supports might be necessary and her overall capabilities. So, again, I see her verbal comprehension within the average range, whereas perceptual reasoning and processing speed are borderline, and her working memory index was in the low average range. So some functional implications. Again, as I said, I do want to make sure that I pay attention to those index scores. But in terms of thinking about what these results mean, I see that she might experience some difficulty, particularly applying abstract visual thinking and reasoning abilities. This may be particularly apparent in some of the time-sensitive situations, so where she has to work in a very rapid manner. She might also experience difficulty based upon these results, not just looking at the full-scale IQ, but also looking at the index scores. She might also experience difficulties with tasks that require cognitive flexibility, mental control, sustained attention. And so if you think about the components of working memory and processing speed, for example, those weaknesses are really manifesting on those subtests, and certainly those subtests are requiring many of the things that we're talking about here in this bullet. The question becomes, though, based on her ability alone, do these difficulties in and of themselves indicate that she would be unable to care for two small children? And so we can't really address this, from the results of the WAIS-IV alone. So there were some selected subtests that were also administered from the WMS-IV, and as you can see here, on the logical memory subtests, both immediate as well as delayed, she earned very poor scores here, as well as on the verbal paired associates, immediate and delayed. So you can see her percentile ranks are extremely low. Her overall auditory memory, index score is within the borderline range. Now, as I mentioned before, one of the very helpful things about the WMS-IV in terms of really understanding a person's performance is to be able to look at some of these contrast scores. Now, you can see here that, given her delayed recall, we don't see really substantial differences between her recognition and delayed recall skills. We're really not seeing, any difference in performance or unusually poor delayed recall given her immediate recall. Again, I'm sorry, we should be saying here that the delayed recall is unexpectedly poor given her immediate recall skills. But again, because these two scores were relatively low to start off with, again, keep in mind that she earned a scaled score of 1. But again, given her skills and compared to other people who have similar levels of immediate recall capabilities, she is performing less well in these areas. And again, given her verbal comprehension capabilities, we certainly know that she really doesn't have language skills that would be impacting, performance in these areas. So certainly, we do see that logical memory, is problematic. But when we look at verbal paired associates, the recognition versus delayed recall, she's really performing about where we would expect. And again, looking at immediate recall versus delayed recall, again, not substantially different, in these. She's doing about as well as what we would expect. As I said, part of what I want to do is also look at the ability and the memory comparison. And if I'm looking at general ability and verbal comprehension, for example, she is doing much more poorly on auditory memory skills than I would expect, given her verbal comprehension capabilities and also given her general ability capabilities. So, again, this is something that shows a significant memory deficit for an individual who has ability, certainly verbal ability, within the average range. Also, in looking at her working memory versus her auditory memory, I do see that she has unexpectedly low auditory memory index scores given her working memory capabilities as well. So in terms of how I would address this within a report, I would address it in this manner. So I would say something to the effect that her initial encoding on the auditory memory tasks was not especially strong. And I saw some similar things in terms of encoding on the WAIS-IV memory items. I did find that her recall was unexpectedly poor, particularly in those delayed conditions, particularly as the stimuli got more lengthy. So definitely the application here, and the important thing to keep in mind is, as I'm looking at caretaking capabilities, is she going to be typically dealing with some of the more lengthy kinds of stimuli? Is she going to have to be encoding information and recalling it? Because those are some things then that can certainly impact her ability to handle child care. And again, I would go into, in my report, this is how I would go about describing some of this information. So I might talk about specifically that on the logical memory subtest delayed logical memory 2, she recalled no details. And, of course, this is the lowest score that is earned. And, again, it's unexpectedly poor and poorer than most others with similar levels of encoding. I might go on to address, again, in that report, that some of the behavioral observations as well. So, as she was asked to recall some of those stories, she became frustrated. She was disbelieving in terms of, even being asked to recall that information. She really didn't make much of an attempt to recall the information, basically saying very quickly she had no idea. So again, we have some information here that this is an individual who is demonstrating some poor skills, in these areas, but we might want to look at perhaps some of the effort that is involved as well. But she did demonstrate inconsistent recognition of some of the verbally presented information, though it was a relatively stronger skill. So, again, what we see here is that she does have some difficulties in the area of memory. Again, we need to put this all within the context of the overall questions that are being asked and looking at whether or not this will impact this woman's ability to care for 2 small children. And, of course, part of that involves then the analysis of this information within the context of the social supports that are provided and the kind of treatment that this woman is obtaining. So again, I can calculate some additional scores in terms of looking at the auditory memory capabilities. I see, of course, that, again, the delayed capabilities are the main area of concern. But if she is asked to recognize, auditory information here, we see that she has done, much better and within the average range. Again, some additional scores that I can take a look at, and you can see here some of the contrast, scores that would be relevant to this particular case. And again, I know I'm going through some of this very rapidly, in the interest of time, just to give you a flavor of how you might go about using some of the various types of, subtests and comparisons that are part of these measures in an evaluation of this nature. Another area, as I mentioned, that is quite relevant because of this woman's, head injury in her history would certainly be looking at executive functioning capabilities. We would often want to look at things like trail making and verbal fluency, for example. As you look at the trail making, for example, you could see that she would need to do a simple task like connecting numbers, and this is just a sample of what the DKEFS trail making task looks like. And again, this is simply looking at the ability to sequence numbers. Another condition would be to look at the sequencing ability for letters. And then one of the more complicated executive functioning tasks actually is to switch then between connecting the numbers and the letters. And so in this case, what we're looking at is her ability to engage in cognitive flexibility and shifting set. The importance of those previous two conditions is to really identify whether or not there are number sequencing issues, for example, or letter sequencing issues that might be impacting a low score. So again, in this woman's case, she earned adequate scaled scores for number sequencing, letter sequencing, as well as number-letter switching. On the verbal fluency task, she also demonstrated very strong skills in terms of letter fluency and category fluency. When she got to category switching, she had her total correct responses were fine, but she lost some of her cognitive set and at times did not engage in the appropriate switching accuracy. So again, how I would use this information and how I would report this, in my description would be talking about how the alternating categories and switching. She experienced greater difficulty. She made more errors, and in this case, she actually had experienced greater difficulty than others in her group, and it indicates that she may have some difficulties with cognitive flexibility. We also had addressed previously some of the issues with frustration in terms of looking at flexibility and variation, again, she works quickly, but she might make more errors. So her ability to sustain attention, to concentrate, to exert mental control, as well as that cognitive flexibility appear to be somewhat weak, and it certainly may suggest that when she has to process routine and complex information, it may take her a little bit more time. Again, she can do it, but it may just take her a little bit more time. So, other things that we would want to do as part of this evaluation, again, would be looking at effort. We would certainly want to assess emotion and behavior. We would also definitely want to take a look at premorbid functioning. Was she functioning in the same way before this accident? And as I said, this is just one piece of the overall assessment. If we were looking at suboptimal effort, again, we could use the ACS as a measure here. Since we had already administered the WAIS-IV, we could simply calculate the WAIS-IV reliable digit span, and we could simply use the WMS-IV, and we had already administered a couple of these subtests. Those are some embedded ways that we could look at effort. If we wanted to use an external measure, we could always use something like the validity indicator profile. So again, some choices that are there in terms of rounding out this overall evaluation. We didn't really see that there were significant indications of suboptimal effort. Yes, she did get frustrated, but she certainly did not necessarily seem to put forth a huge amount of effort in recalling, but her performances were fairly typical of others with a similar type of a profile. As I mentioned, we would want to do a mental health assessment, and I saw somebody ask that question in the chat box. According to the results of the MMPI restructured form and our interview. She does have some avoidant personality features, but there really is there was no diagnosis, and the depression, again, that did not come up as something that was a significant concern, in terms of the actual assessment of, this person. I realize I put the wrong poll in here. I apologize, so I'm going to skip over that, and we'll just talk a little bit about drawing some conclusions. As I mentioned, we would have to interpret these results within the context of all of the assessment procedures. We'd need to look at the husband and, what he had reported. We'd need to look at the children and their needs. But most of the data that we have collected as part of this evaluation at this point suggests that she may need some support in caring for the children, but she should be able to provide basic care. She may need some things like notes, she may need reminders, and she may need some family support. But again, at this point, we certainly don't have any indication that she should not have, that she should not have some caretaking responsibilities for the children. We certainly have not gotten all of the information yet, and again, I wouldn't want to conclude at this point. Should the children reside primarily with the husband? Should they reside primarily with the wife? What kind of shared custody? What kind of visitation? But there's nothing here that would indicate that this woman should have only supervised visits, for example, with the children. So again, this gives us a place to and some standardized, reliable, valid data that can stand up in court. One of the risks in forensic assessments, we see a lot of people doing interviews, and again, we don't necessarily have then the standardized psychometric data that can bolster our opinions. And, of course, what we want to be doing is making data-based decisions in these cases. So, again, that's an example of how you could use the WAIS, the WIMS, and ACS procedures in a child custody case. If we were looking at a capital punishment case, again, we're looking at a very different kind of a scenario. Here, it is, important for us to recognize that, although Adkins, is, the standard that we're looking at, it's important to remember that there are a number of influences that go into determining whether or not somebody is competent. It's important, of course, as psychologists that we advocate that a competent professional assessment is done that doesn't just focus on an IQ score. And, again, it involves a very systematic assessment. It's important for us to look at not just that IQ score, but a careful observation, a careful interview, and, of course, this requires the proper training and experience within, forensics and looking at capital punishment cases, for example. So as we think about, this particular case, we see that we're dealing with a 19-year-old young man. He had dropped out of school in the 10th grade, and, at age 18, he was involved with two other friends in the murder of a young woman. As you can see, the three defendants were convicted of first-degree murder. Sorry about that, and sentenced to death. And the attorney here is arguing that Sam should not be executed because he has an intellectual disability. And so there are a number of things that we want to take a look at here. The main question, of course, is, does Sam have an intellectual disability? What is involved in terms of the secondary gain? And certainly we do have secondary gain here because he is facing a death penalty sentence. And the question may become, does Sam have have some external incentives to exaggerate his symptoms or to feign an intellectual disability? So a highly complex, highly emotionally charged situation. And again, this goes back to preparing yourself as a clinician in conducting these kinds of evaluations. But central to what we're looking at in a capital punishment evaluation, in addressing intellectual disability, we obviously need to be familiar with the definitions of an intellectual disability. As you can see here, this is the AAID definition, which is, of course, addressing both deficits in intellectual functioning and adaptive behavior. And a key component here is, of course, that this disability has to originate before the age of 18. Other key components in that AAID definition, and again, this is often a key standard that is used by those who are conducting assessments in this type of a case. We do need to take into account, of course, the other kinds of factors that are involved: the community environment, the peers, the culture, and of course any linguistic or cultural diversity of the clients that we are assessing. So, in looking at Sam, of course, we want to be looking at his general, intellectual ability, and most commonly in many states, an IQ test score of 70 to 75 is going to indicate a limitation in intellectual functioning. And then, of course, adaptive behavior measures would also be used to look at any deficits that exist in conceptual skills, things like language and literacy, ability to understand money, time, and number, looking also at deficits in social skills and interpersonal relationships, so social responsibility, gullibility, naivety. So, again, can this person avoid being victimized? Can this person avoid, simply following the crowd? So these are all elements of adaptive behavior skills that might be important in this kind of a forensic evaluation, as well as, of course, looking at the personal living skills or daily living skills, such as personal care and things of that nature. So, in combining and in addressing this assessment for Sam, we might want to put together something that a battery that would look like this. And so you can see that there are some similarities between what we did in a child custody evaluation and some differences in terms of things that we could select. One of the things that's important with Sam, the verbal fluency test was actually not administered due to some of the language limitations, with this youngster. So a records review is, of course, an important component in this overall assessment because of that condition that we need to look for onset before the age of 18. So in looking at the records review, we do see that Sam was classified with behavioral/emotional disability. And again, of course, the characteristics or the labels might be different depending upon the state. that a student was educated in. We do see that he has had previous scores on measures of intellectual ability that were in the extremely low range. We have seen historically adaptive behavior skills in the below average range, but not as low as his cognitive capabilities that were measured at that time. He did receive educational services in a separate classroom from kindergarten through grade 10. And as you can see, he was evaluated a number of times, and at the end of each of these evaluations, there was some question, about his classification, but he never was actually classified as a student with an intellectual disability, primarily because of his scores on the adaptive behavior measures. Again, in looking at his adaptive behavior measures, remember that those were always within the low average range, but not considered to be deficient. So you also find that he did have a score on the test of nonverbal intelligence in the low average range as well. So this is the one exception that exists in terms of looking at those cognitive abilities as being significantly delayed. What we know in terms of the clinical validity studies that are available in the WAIS-IV manual, this is just a summary of the scores that individuals who have been diagnosed or classified with an intellectual disability of mild severity. We see that their means are typically in the low to mid-60s with that full scale, ranging at a 58.5. And some of you may be wondering, well, why is that score lower than any of these other measures? And that is because, again, the way regression to the mean operates, one of the things that we see is that it's highly unusual, I shouldn't say highly unusual, but it's atypical for somebody to be scoring uniformly low on all measures. So consequently, that full-scale IQ comes out to be somewhat lower. Again, as compared to matched controls, we do see that there are significant differences. So how did Sam compare in this situation? As you can see, his scores are very similar to the mild intellectual disability clinical validity studies that we just presented. We see that there is somewhat of a strength, although it is not clinically nor statistically significantly different, I believe, on processing speed. And again, these tend to be some more rote kinds of tasks, so it isn't uncommon to see processing speed to be a little bit higher. So again, his cognitive scores in terms of general ability are looking, fairly similar to, intellectual ability, to intellectual disabilities of the mild form. We don't see any variation in his overall performance in terms of looking at those indices. Again, uniformly low performance. So in terms of ability, again, we see, and we would write in our report, that his overall or his general cognitive skills are within the extremely low range, and you would then talk about his processing speed score as being within the borderline range. Again, though, not significantly different. So functionally, we would see and expect that Sam would experience difficulties in keeping up with his peers on tasks that required reasoning capabilities. Now, if you remember from Sam's history, though, those cognitive ability results aren't drastically different from what we've seen previously. It was always the adaptive behavior skills where Sam had performed adequately. So it's important for us to get an updated estimate of his skills in this area, And again, for this, we use the Texas Functional Living Scales. And again, this is going to be a very brief assessment of his functional competence. We could also use something like the Vineland in order to look at his adaptive behavior skills. One of the nice things about the Texas Functional Living Scale is that it does really give a pretty good idea of instrumental activities of daily living. So it does tend to be very functional in terms of looking at performance. So, typically in a group of individuals with mild intellectual disabilities, and again, this is from the clinical validity studies that were done in the development of the instrument, we see that those individuals are typically earning an overall score of 28.6, and that is significantly lower than a control group who do not have intellectual disabilities, and looking at their performance, of course, at a 52.6. Again, very strong effect sizes. So what does SAM look like? Well, if you think about that total score, and remember that SAM, that total score that is typical for individuals with mild intellectual disabilities, it was 28.6. Sam is earning a TIFLS total of 30. So you can see that he is demonstrating in this case, in terms of looking at all of these different areas, communication, memory, all of these different areas of instrumental activities of daily living. He is performing in a lower range than what would be expected. Probably at this point, I would also want to add in some results from the Vineland because, again, some of these kinds of activities are, going to be potentially related to, some of the cognitive and achievement skills. We might want to look at, some additional information from the Vineland. But again, you do have some significant indications here that activities of daily living, are going to be problematic for SAM. Again, just like we had in the child custody example, we have a couple of executive functioning subtests that could be administered to SAM. As I mentioned, the verbal fluency subtest was not administered. Trail making was, and we did see that he had, basically, lower performance on these areas. But again, I probably, as I look at and think about his cognitive capabilities, this isn't terribly unexpected. Again, there could be some other executive functioning components that we might want to administer. And as I mentioned, depending upon the individual's presenting characteristics, you might want to add on, other components of executive functioning. You might want to do a little bit more with social perception, for example. Is Sam having difficulty in terms of looking at and analyzing emotionally, affect-laden kinds of scenarios? Again, I would expect probably that he wouldn't do quite as well with some things like prosody. Given his intellectual ability, the subtlety of recognizing sarcasm and things of that nature, might be problematic for him. Probably most relevant to Sam's case would be taking a look at suboptimal effort. And, again, one of the reasons why this would be so important in Sam's case is that he does certainly have a substantial external incentive to feign intellectual disability. So in terms of looking at this component with the ACS, as I mentioned, we could look at administering to SAM word choice, reliable digit span, and we could address some of the components of the WMS-IV. As I mentioned, the advantage of using some of these measures is that they are embedded measures of suboptimal effort. So while you are obtaining information concerning this individual's cognitive functioning, you can also obtain information concerning effort. Now, word choice is an example of an external measure of effort. And as you can see here, what the examinee is asked to do, and again, this is part of the ACS, the examinee would see and hear 50 words, in succession. They would have to identify each word as either man-made or natural. And again, part of the reason why that is done is to make sure that they're focusing on the words that they're seeing and hearing. And then they are looking at a card with 50 pairs of words, and they simply have to select the word that was previously presented. So, generally a fairly simple task. It's not going to take an extended amount of time in order to administer. So that would be, analogous to using something like the VIP in terms of, or the validity indicator profile, in terms of an external measure that could be used in Sam's case to determine whether there were indications of suboptimal effort or perhaps trying to present oneself as having an intellectual disability when in fact he did not. As we said, other kinds of measures that would be embedded would be the use of the reliable digit span. And again, part of what is done here is, of course, you're looking at some of the information on digit span forward in terms of looking at their best performances. And, of course, you're also looking at digit span backward. So, again, where are they earning their best performances? And it only involves looking at reliable digit span forward as well as backward, not the sequencing condition. And then there are, of course, scores that you're calculating and information that you're looking at in terms of whether or not there is an indication of suboptimal effort in Sam's performance on the reliable digit span. Other measures, as we said, this gets, and I know I'm running out of time. I had a feeling this might be a little bit too much information to try to cover in an hour and a half, but other things that you would want to take a look at would, of course, involve, again, the performance on some of those other embedded indicators and or other embedded measures. And with your handout, you do have the report that describes Sam's overall performance. And I'm going to pull that up really quickly. Again, since I know we don't have a whole lot of time, and just make sure that you know where to reference this. You should all be seeing now the effort assessment score report for Sam. And, again, you can see that my colleague, Dr. Gloria McCoo, who's been answering, I know, some of your questions, has, put together this report. And, again, we can see from this that, of course, we have our general ability index. We've got our delayed memory index scores, both in the extremely low range. It would probably be a good idea for us to set up some kind of a webinar that just talks about the suboptimal effort scores and how you go about interpreting all of this, because it is a little bit complex. But essentially what you're doing as a clinician is you are setting an overall cut point a priori in terms of looking at whether or not this individual is showing a pattern of suboptimal performance. And so you can see here that only about 5% of the overall sample obtained a raw score of 35 or less on word choice. And again, you can see that marked by the X here. If I look at the totals over here, you can see that the base rate for individuals earning 4 or more 4 scores that were below that cut point here, we don't see that happening all that often. So in this case, those 1, 2, 3, 4, this person had 4 total scores that were below that cut point of 10%. Again, not a very typical kind of performance, but we have to put that in perspective with SAM's overall cognitive capabilities. So these particular reports, and again, because I don't have enough time to really delve into it, this really should probably, as I said, be an hour-long webinar just looking at suboptimal effort. But it would be important for us to take a look at the intellectual disability group, and we see that not very many people have 4 scores below that cut point. So only 3 have scores there, 3%. If we look down here, again, the number of scores, again, only 16% of the group with intellectual disability have 3 scores that are below that cut point of 10%. So, as I mentioned, what this is really beginning to indicate is that SAM, certainly has, some indications that there may be, some suboptimal effort. That is something that we would want to, take a look at in our overall interpretation. And really we would want to be thinking about that in terms of, what we would do based on these results in terms of a mild intellectual disability. He does have some significant limitations in his intellectual functioning and his adaptive behavior. It does appear that there are limitations that originated before the age of 18 in the area of cognitive functioning, but I'm not sure that we have that data in the adaptive behavior area. So, again, there's a lot more that we would probably want to take a look at, and we want to do, a much more detailed analysis of his overall effort in terms of understanding his performance on these overall measures. So, and again, I apologize that I didn't have a whole lot of time to delve into those results and explain them more fully. You could, certainly think about, where you might be going in terms of your thinking, in regard to conclusions about SAM. I'm not going to ask you to make that determination right now, but you probably, like I said, have some hypotheses based upon the data that you have seen. Just to tie things up, and again, I apologize that we are running out of time here, but some things to think about in terms of your own further development in the area of forensics in general, would be that you could look at some of the additional readings that are listed here, and keeping in mind that although the Supreme Court has determined that those who have intellectual disabilities are barred from the death penalty, many times, we still are looking at the influence of the jury. We're looking at the influence of judges. Again, one of the things that's interesting is that as you look at some of the studies that are out there, we do see that jurors and in their analysis of intellectual disabilities, they're looking for much more impaired functioning than typically what mental health experts are looking for. And that has to do with the results that are provided in this study right here. It was a very interesting study of looking at jury pool members and what they thought of in terms of looking at intellectual disabilities. Again, we haven't really even touched on the whole idea of looking at the mental health impairments and other issues related to competence, for example, regarding impact of psychosis, schizophrenia, things of that nature. Again, I know we're here at the end, and I want to be respectful of people's time. Sorry for a little bit of the rush here. If you do have additional interest in forensics, again, I encourage you to look at some of the forensic guidelines that are available on the web as well. But I do appreciate you joining us this afternoon for a very quick overview of how the WIMS, the ACS, and the WAIS might be used to inform our decision-making in forensic types of evaluations. If you have additional questions regarding the instruments, feel free to contact our customer care offices. If you have specific questions regarding this webinar, I can be reached at this email. And then again, we just have some additional references for you or links that you can take a look at. There's a lot of information about the ACS and the WAIS-IV and the WMS-IV on the website. Again, I thank you for your time, and we will be reviewing the questions that came up in the chat box. I'll leave that open for a couple of minutes here in case there are additional questions that come in, and we will send out a written Q&A to those who were participating in this session. But thank you again, and I hope you all have a wonderful afternoon.